Hello friends, I am Dr.Udaykumar and today we are going to discuss about HIV and its manifestation in the CNS. I am representing the Life Care Clinic from Aurangabad. Life Care Clinic is one of the few centers which have been working in HIV since past 12 years. Diseases of the central nervous system in patients infected with the human immunodeficiency virus result directly from HIV itself or from a variety of opportunistic infections. These infections include progressive multifocal leukoencephalopathy, toxoplasmosis and cryptococcosis. A resurgence of tuberculosis and neurosyphilis has also been documented in the mass lesions, meningoencephalitis, demyelination, atrophy, and vascular lesions are the commonly encountered imaging findings. The introduction of highly active antiretroviral therapy has improved both the clinical and radiological findings in HIV-infected patients and reduced the number of opportunistic infections. In countries that use heart, AIDS-acquired immunodeficiency syndrome, dementia complex is becoming the most common neurological complication of HIV infection, whereas opportunistic infections are still the major cause of neurological complications in patients from countries that do not commonly use heart. Immune reconstitution syndrome, which occurs in some patients in weeks to months after the institution of heart, may alter the typical imaging appearance of infectious diseases involving the CNS. Knowledge of the spectrum of imaging findings of this infectious disease as well as the effect that treatment has on imaging appearances is important in the evaluation of HIV-infected patients. Describing the clinical and pathological features of CNS infections in patients with HIV infection. Let's identify the imaging patterns of central nervous system infections in patients with HIV infection. We will discuss the differential diagnosis of CNS infections patients with HIV infection introduction. The HIV or human immunodeficiency virus is a retrovirus that infects cells of the immune system and destroys or disrupts their function. In the more advanced stages of HIV infection, acquired immunodeficiency syndrome, that is AIDS, develops. According to the Joint United Nations Program on HIV or AIDS, an estimated 39.5 million people are infected with HIV. HIV is a neurotropic virus that enters the central nervous system early in the course of the infection. Up to 60% of the AIDS patient will have neurological manifestations, and the era before us of highly active antiretroviral therapy, that is heart and neurological disease, was the first manifestation of symptomatic HIV infection. 10 to 20% of patients do suffer from neurotropic infection. HIV causes the intact blood-brain barrier. The virus has been cultured from the brain, nerve, and the cerebrospinal fluid of patients of all stages of the disease. This virus infects the cells of the monocyte macrophage lineage and the indirect effects of macrophage. Activation are implicated as a cause of nervous system injury in HIV infection. Although HIV has previously been described as not directly infecting the astrocytes or oligodendrocytes, evidence is building that HIV may infect these cells as well. Neurological complications arise from the HIV infection itself, from secondary opportunistic infections and neoplasms, and from drug-related complications of the therapy. The opportunistic infections are varied and include progressive multifocal leukoencephalopathy or PML, cytomegalovirus or CMV, and fungal infections. A resurgence of CNS tuberculosis and neurosyphilis has also occurred with the advent of HIV infection. Development of neurological manifestation depends on a variety of factors, including therapy and antiretroviral drugs and the patient's overall degree of immunosuppression. A decrease of the CD4 receptor positive T lymphocytes in the best predictor of the potential development of opportunistic infections. The patient is most vulnerable when the CD4 counts fall below 200 cells per microliter. Neuroradiological findings in HIV infection vary depending on the underlying etiology. In addition, multiple conditions may involve the nervous system simultaneously. The advent of heart, which has been used in Western countries to treat HIV-infected patients since 1996, has resulted in decline in the incidence of neurological complications, especially those caused by the opportunistic infection. In countries where a heart is available, cognitive dysfunction and peripheral neuropathies caused directly by HIV represent the majority of cases of HIV-related neurological disorders. In other countries, opportunistic infections of the CNS are more common. Immune reconstitution inflammatory syndrome or IRIS is a complication of heart that causes transient worsening or appearance of new signs, symptoms, or radiological manifestations of opportunistic infection after initiation of the therapy. Occasionally, IRIS may be associated with a fatal outcome. IRIS is thought to arise from restoration of immune response and it impacts the imaging findings. Knowledge of the imaging findings associated with various infections against agents that involve the CNS in HIV infected patients as well as the impact of treatment on them is important in building therapy. In this article, we summarize the pathological and imaging features of AIDS dementia complex, PML, toxoplasmosis, CMV infection, fungal infection, and tuberculosis, and neurosyphilis are emphasized, followed by a brief discussion on IRIS. Now let's see what is the AIDS dementia complex. AIDS dementia complex is an HIV associated chronic neurodegenerative syndrome characterized by progressive cognitive and motor impairment and atrophic changes involving the brain. Although AIDS patients have improved survival rates because of the antiretroviral therapy, approximately 15 to 20% of the patients develop AIDS dementia complex, and it is one of the most common cause of morbidity in this group. Please subscribe to my YouTube channel for more updates and knowledge of HIV and AIDS in the community. If any doubts, you can call on my number or email me for any queries. Thank you.